Hello everyone. Hi, I am Jewel and welcome. Welcome to my channel. Today's topic is peritonitis. This is a topic I can speak on personally. This information is coming from the National Kidney Foundation, so let's get started. What is peritonitis? Peritonitis is inflammation of the peritoneum, the inside lining of your own belly that acts as a natural filter. In peritoneal dialysis, waste products are removed through the peritoneum with a cleansing fluid called dialysate, which is washed in and out of your abdomen cavity, which is the belly, in cycles. The peritoneum has fluid and covers the organs within your belly to protect and support them. What causes peritonitis? Peritonitis is usually due to a bacterial or fungal infection. The infection can happen from any rupture in the belly area, such as a burst appendix. It can also happen from an injury or trauma to the belly, or as a complication of other medical problems. Peritonitis can also affect people on peritoneal dialysis. Improved technology and self-care methods have lowered the risk of peritonitis for people on peritoneal dialysis, but the risk for infection still remains. Therefore, if you are on peritoneal dialysis, it is important to practice good hygiene during your dialysis treatment and to be sure to take the right steps to help reduce the risk of infection. These include washing your hands before dialysis treatment, wearing a mask during treatment, applying an antibiotic cream to the catheter exit site as often as prescribed, and other steps recommended by your healthcare team. Is peritonitis serious? Peritonitis can be life-threatening and may cause serious complications, depending on the cause and severity. It can also lead to sepsis, a life-threatening condition caused by the body's reaction to an infection. Common symptoms of peritonitis can include pain in the abdomen, which is the belly area, tenderness within the abdomen, bloating or outward expansion of the abdomen, also known as distension, nausea and vomiting, fever, cloudy peritoneal fluid during peritoneal dialysis treatment. Peritonitis can also be quite serious, so if you have any of these symptoms, you should seek medical help right away. How is peritonitis diagnosed? You will receive a physician's exam for signs and symptoms. Your belly will be checked for tenderness or distension. Blood tests, x-rays, or computerized tomography, CT scans might also be done. Some fluids will be removed for testing to confirm whether an infection is present. How is peritonitis treated? People with peritonitis may have to be admitted to the hospital. Treatment for a bacterial infection usually includes antibiotics given as an intravenous IV injection in the vein. Other supportive treatments such as IV fluids and drugs to maintain blood pressure are given, especially if sepsis is a concern. Symptoms of sepsis can include low blood pressure, fast heart rate, fever, or difficulty breathing, so other treatments might also be needed. Emergency surgery can also be considered, especially if a ruptured appendix or other related conditions have happened. An operation may also be needed to remove damaged parts of the peritoneum. If peritonitis happens with peritoneal dialysis, then the antibiotics can be given in the peritoneal dialysis fluid. Sometimes a different form of dialysis might be needed temporarily while the body heals from the infection. If peritonitis continues to keep returning, then peritoneal dialysis might need to be stopped and a different form of dialysis might be needed. Okay, everyone, this is peritonitis. And as the article states, it can be very, very serious. I did peritoneal dialysis (PD) for a few years before my transplant, and I did wind up with peritonitis a couple of times. The first time, I didn't know what it was, so it became very, very serious, very, very quickly, which landed me in the hospital for quite a long time. But eventually, it all cleared up, and of course, like they said, you have to use another form of dialysis. So I did hemodialysis in the hospital while they treated my peritonitis. But as the article said, peritonitis can be quite serious, even if you do all the steps that you're supposed to be doing, which is washing your hands, wearing a mask, using antibiotics. Sometimes things just happen, and you don't have control over it. So this is peritonitis is can be quite serious, a very very serious illness, through peritoneal dialysis. But even through that illness, I would still choose, if I had to do dialysis again, I would still choose PD because, like I've stated before, PD um, gave me the freedom that I needed. I didn't have to go to the clinic. My water restriction was lifted because I was able to take off my own fluid, and also the you can eat a whole lot. The diet is not as serious as a hemodialysis diet. So those are some of the reasons why I chose PD, and the other reason is because I just felt better doing peritoneal dialysis. So everyone, this is peritonitis, and of course, like I said, it can be very, very serious, but they have found ways, of course, with all the management of the kidney disease to manage this infection quite well, because I've had it for a couple of times before I had my transplant, and each time I understood better how to diagnose it before it became very, very serious. So, guys, if you found this information useful in any way, please like, share, and subscribe. And as always, I'm sending you so much love and affection, like every CKD patient, because we have walked this walk with you and we know exactly what you're going through. So, the only thing that you have to do, of course, is stay positive, stay hopeful, and hopefully one day this too shall pass. So, guys, take care of yourselves, and I will see you on the next video. Bye.